Are your eyes dry? Are you tired of taking all kinds of drops?
Yeah, do you guys script this or just off the cuff it?
It's off the cuff.
I love that.
And I mess with y'all's mics too.
No lint, right?
Hmm?
No lint, no dandruff. I'm
You
good.
guys want your pens in your pockets?
Ugh, no.
Nerds. Okay, scooch a little, Dr. King, a little bit more.
Actually,
elbow
each
in.
other.
Yeah. Perfect.
Don't touch me.
Family.
But whenever y'all are ready, you can do your intro.
But it's Friday, not Tuesday. It messes me up.
True.
That's valid.
All right.
Well, at least
True.
it's before 3.
Okay. Hi, I'm Dr. King,
And I'm Dr. Cha.
and welcome to Days of Our Eyes. Do you have dry eye, irritated eyes, and some skin flushing problems? This is not good. Let's try again.
Skin flushing
Okay,
problems.
that's okay.
Some flesh-eating bacteria.
Do you have a
Flesh-
ruddy complexion? Let me help. I did not go
It was your
today.
idea
I
to film
completely
today.
forgot. It was not my idea. I just said we could. So. Hi, I'm Dr. King.
And I'm Dr. Cha.
Welcome to Days of Our Eyes. Today we want to talk about intense pulse light therapy. What is it? What does it do? What's it good for? When should you use it? Who does it work on? Stick around. We'll let you know. So let's talk about intense pulse light therapy.
Okay.
Where did it come from? Do you know?
I believe it originated from dermatological practices, so skin doctors. Why are we talking about a skin procedure when we're eye doctors, Dr. King?
Well, good question. Our eyes, our eyelids are actually skin. Our eyes are neighbors to the rest of this area. I'm sorry.
It's all good.
I am just not well thought out.
Yeah.
All right.
Okay.
So anyway, our eyelids help influence the surface of the eye. Our tears are made in our eyelids. So if we have problems with the skin surrounding the eyes, that is going to affect the surface. We have to have a healthy environment, and that starts with the lids and the skin surrounding the eyes. So these dermatologists were treating skin conditions such as rosacea, which is where we have these blood vessels close to the surface. Skin tends to have a reddish appearance. People blush easily. When they treated patients' rosacea, which is down here, people's dry eye actually improved. And they're like, hey, maybe we're onto something here. So it has evolved over the years that it's now becoming one of the first-line defenses in ocular surface disease or dry eye disease. Refer back to our previous episodes on ocular surface disease. So IPL, or intense pulse light, is now used on a daily basis to help treat the ocular surface.
So, IPL, intense pulse light, what does that mean? Are you going to shoot lasers at me, or?
It's not a laser.
Oh.
It is exactly what it says. It's very focused light. Now, a laser is like hyper-focused light.
How many treatments should the average dry eye patient expect to have?
For a typical dry eye treatment, it's usually around 4 IPL treatments. Those treatments are typically done about 3 weeks apart. We treat, we let the skin process, we let it absorb, and then we treat again. And by doing that, we're actually building up the treatment and building up the effectiveness. So it's a cumulative effect.
When the skin doctors were using it, was it just to clean up that redness, or what does the intense pulse light do for our dry eye patients?
Well, that is something that sometimes even I go, what? The wavelengths of light tend to treat red or brown. They're attracted to certain pigments at certain depths, and it actually treats inflammation. It's actually going to reduce the inflammatory response, and it can also stimulate some of the glands, particularly meibomian glands in the eyelids and whatnot, and actually rejuvenate those. So there are some studies where you take some pictures of people's oil glands in their eyelids, those are called meibomian glands, and you take them before intense pulse light treatment and after intense pulse light treatment, and they actually experience, you know, an invigoration of the glands. They look more robust. One of the problems with ocular surface disease and meibomian gland disease is the glands will atrophy. They'll actually start to die off. With IPL, we can stop that process and try to reverse it a little bit. And the effects of IPL last quite a while. They can last 6 months up to a year. And what's nice is you do those initial 4 treatments, usually with also some lid expression, such as a lipoflow after the 3rd treatment is quite often done. But you do these 4 treatments. It's not like you're doing that whole thing every year. After you go through this, most folks can do just a little, I call it a tune-up or a refresh, where we just do 1 IPL treatment, you know, 6 months to a year down the road based on symptoms. And the process itself is fairly easy to go through. It's not painful. It can feel a little bit like a rubber band snap. The thing about the IPL is, you know, it's like a glass block that transmits the light. So we put a conduction gel, like an ultrasound gel, on the skin, and we actually just go across and treat the areas that need to be treated. What's interesting about IPL and intense pulse light, it's not just dry eye, it's anti-inflammatory, right? We're going after inflammation in the skin in the layers of the epidermis. And we can actually use different filters, go after rosacea. Rosacea is a skin condition. We can go after the meibomian glands, it's more dry eye. We can even treat pigmented lesions, such as cafe au lait spots or age spots like I have. Lighten mine up pretty good. Hopefully we have a good gauze filter to. But depending on the wavelength light we use, we can treat at different depths and different conditions.
I mean, we even treat ocular rosacea.
Yes.
Right? There's dry eyes that come from rosacea of the skin, but sometimes you can have it just in the skin in and around the eyes, the eyelids, and that causes pretty gnarly dry eye.
Yeah, it's really uncomfortable. Those folks that have those red rimmed eyes, if you're walking around and your eyes are always just, the edges of them are always looking red, quite often that's a condition called ocular rosacea, and intense pulse light IPL is custom designed for that type of problem. Oh, and it's got one really cool side effect that a lot of my patients like.
Side effect?
Yeah. The side effect of it tends to smooth the skin. The skin looks a little refreshed. I had one patient tell me, she goes, I know my dry eye is better, but my kids say I look better, so that's always a win.
So give me more of it.
The folks that want to avoid this are very darkly pigmented. And now we're actually getting into radio frequency and some other things that we're going to be able to treat all skin types. The other things is if you're on any sort of photosensitizing medications, such as tetracyclines, a lot of acne medications, your isoretinoids and stuff.
Even certain steroids, correct? Corticosteroids?
Yep, you shouldn't be on steroids at the time of treatment. So there are certain medical reasons we would not do this. That's why you want to see your local eye doc that does this. And they'll be able to look at your health status. And you do want to avoid, when you're going through these treatments, you do want to avoid excessive sun exposure, because we are in wavelengths of light that are contained in the UV spectrum too, so we don't want to overexpose the skin to those kinds of lights. So we ask you to use sunblock while you're going through your treatments.
Like, why would a patient choose IPL over the conventional drop?
There's 2 answers to that. One is, IPL is dropless, which is nice. We're treating the skin, we're treating around the eyes. So some folks aren't good at doing drops. And a lot of times when it comes to ocular surface disease, though, there is no one silver bullet. It's a very complex condition. So I position IPL along with something else usually too. Maybe a drop, maybe just an at-home lid therapy. But it's fabulous, and then some of this other stuff can support it. Does that make sense? Does that answer your question?
Yeah, like you said, it's no silver bullet, There's no cure to dry eye.
No, this is just a chronic progressive disease, and we are going to do everything we can to battle it.
Right. So, just like you said, just having the IPL treatment doesn't mean that you'll be cured forever.
No.
You still have to, our patients still have to be cognizant of their eyes and, do what's best for them. They can't just stare at a screen all day, thinking,
Yeah.
IPL is really unique and great because it truly treats the underlying cause of dry eye. A lot of the therapies that we use, especially like something like a lubricating drop artificial tear, even like a corticosteroid that you put into your eye, it treats the symptoms and, it tries to target the underlying cause of inflammation. A lot of times it's almost like a band-aid solution, right? Hopefully it gets you over the hump, that you're experiencing if it's like a flare-up. But IPL treats the vessels that are the source of the inflammation.
Right.
Because
we're still learning, how is all this inflammation getting there? Where is it coming from? How's it translating onto the ocular surface? So if we can use these tools, and IPL is turning out to be an invaluable tool to get at that underlying inflammation, then we reduce the need for all these drops and stuff. It's really not just about putting drops on the eyes. It's about getting the surface back in balance. We don't want the tears to be toxic to the surface. We want the tears to be healthy and feed the surface of the eye. And a lot of those tears are made in the glands in the eyelids. So let's fix them. So we hope you learned something about IPL today. And hope I wasn't too preachy. Sometimes I get all serious, Anyway, thanks for watching Days of Our Eyes. I'm Dr. King.
And I'm Dr. Chow.
And if you like what you saw today, please hit subscribe and hit like. And if you have any questions, drop them in the box. We'll do our best to answer for you. And everybody have a great day. See you next time.